I am Praneeth Devalraj. I am 40 years old. I am from Hyderabad. I work with banking technology. Most of my time goes on working on systems and it's a sitting job. I am also quite active with sports and physical activities as well. I drive a lot. Over a period of time, I have developed some issues with my upper back and some spondylitis as well. But off late, about a month and a half ago, I have started realizing that I am experiencing numbness in my hands, pain from my shoulder radiating into the hand. I have visited multiple doctors. I usually thought this is a small issue. I got some physiotherapies done. I visited a lot of orthopedists, but it didn't help a lot. I got to know about Dr. VRK here practicing at Arete Hospital. So we approached doctor. I think he was very quick to diagnose the issue. He was extremely patient. He looked at our concerns very carefully and he was going very conservative in terms of treatment to see if there are any non-surgical procedures which can help me. But there was no other go but to go for a surgical procedure here. The options were clearly evaluated, very clearly discussed with us. Then we said we want to go for the cervical disc replacement surgery. So he talked us through all the risks associated, all the challenges that are associated and the recovery time. So everything was communicated perfectly with us. We trusted the doctor because the way he approached the problem was very methodical. Then we went ahead with the surgery. In terms of the surgery day itself, I think the hospital staff were extremely supportive. The pre-medical tests and everything were very well handled. We've always had one person as a concierge helping us all through the process, all the steps. And the facility is excellent. It almost feels like a 5-star hotel. The doctors seem very caring. So I think we're extremely happy with the experience.
This is about a 40-year-old gentleman came with the chief complaints of neck pain with left upper limb radiation. On investigation, we found that there was a disc compressing his nerve root because of which he is having the pain. The diagnosis was C6-7 intervertebral disc prolapse, which means the disc has protruded out and imposing pressure on his left-sided nerve root. We have started on medication with the trial of conservative management. So over a period of time, even the conservative management has not worked for him and day by day his symptoms have worsened. Then we have thought of going for the surgery. Considering him as an active individual and active lifestyle and professional software by occupation, then we thought of preserving the disc motion. Usually what happens is we remove the disc which is compressing the nerve root and we fuse that level, which will restrict the movement of the neck at that particular level. And we thought of preserving the motion at that particular level and opted for a disc replacement. So we have done a disc replacement for him and post-operatively the very next day he's mobilized and his pain is completely relieved. Now that he's happy and he has regained his neck movements to the normal, which will help him in having the active lifestyle like before.
I'd like to especially thank Mr. VRK for taking up our case and performing the procedure so well with us. The experience has been positive both with the doctor as well as the Arete Hospital. Thanks to Arete Hospital as well.